CTSI to, thank you, to provide a few comments about the CTSI.
Thanks, Sarah. Hi, everybody. It's really great to be here. I'm Sara Wiehe. As a pediatrician, I was particularly excited to see the agenda and bummed that I'm not able to stay, actually, but perhaps can catch some of the recorded presentations at a later date. So I was very pleased to come and help to kick off this event and just give you a 2-minute quick overview of the CTSI. Many of you may know this, and I see a lot of familiar faces in the audience. So the Indiana Clinical and Translational Sciences Institute is a partnership of Indiana University, Purdue University, and the University of Notre Dame, the 3 R1 institutions in the state of Indiana. And our mission is to bring together the state's brightest minds to solve the state's most pressing health challenges. Co-director with me is Dr. Sharon Moe, and we have deputy directors at every partner campus. We are a part of a 60 Clinical and Translational Science Award Consortium across the US, and the Indiana CTSI is the only hub in Indiana and one of the few statewide CTSAs. We have over 20 programs and 80 service corps available to investigators across the state. And we're just renewed in 2023 for a 7-year period. And the focus that we have been given by the NIH for this period is outlined here on the left. It is to support innovations that speed the development of medicine, promote partnerships and collaboration, resource for rapid response to public health needs, nurture the field of translational science, a focus of training and career development, and to address health disparities. Many of those I think you're touching on today with this very translational symposium. So the goal of both Indiana CTSI and the other CTSAs is to provide infrastructure for translational research and national connectivity to promote program impact. We have a statewide CTSI ecosystem that consists of many partners, and this is really the foundation of, I think, the value that we offer to the investigators that are part of the Indiana CTSI. So in addition to the academic institutions that I mentioned, the Regan Street Institute, as well as a new partnership with Ivy Tech. We have multiple partnerships with healthcare institutions across the state to facilitate statewide clinical research and clinical trials research. Many community organizations, including at least one in all 92 counties. We have an online engagement platform with the general public to promote research literacy and health literacy, and with many corporations and industry, many of whom are in the room here today. So what does the CTSI do? We convene, collaborate, and catalyze through our resources, pilot funding, and most importantly, our people. And that's to help accelerate translational research with the priorities noted earlier. And these are some more specifics of what we do. The bottom line that I wanted to stress was that your success is our success. Please come to us if we can be of assistance. We have navigators at every campus. You can find more information on our website, but it includes all these things, including in data and analytics support, clinical research infrastructure, expert consultation and funding for your grant proposals. And I could go on, but I'm going to stop there. Have a wonderful symposium, and thank you for all the fine work that you do.
Thank you, Sarah. Before she gets away, are there any questions for Dr. Wiehe? Thank you. Again, if I forgot to introduce myself, I'm Sara Quinny. I'm the director of the Disease and Therapeutic Response Modeling Program here at Indiana University, and I'm also the PI with Langley and Rob Bees of the Imprint Maternal Pediatric Precision and Therapeutics Hub, Data Model Knowledge Research Coordinating Center. So wanted to give a little bit of background on this modeling program. You see up here our current faculty minus Dr. Lais De Silva, who may, up there you are. I was like, these were from last year, so there, or that was from last year. So there was, she was new last year. So we're excited that she was able to join us a year ago and has been phenomenal support for our preclinical study design component. The modeling program was founded by Rob Bees and Dave Flockhart about 14 years ago now. So has a long history of training postdoctoral fellows and graduate students to support the design, application, and interpretation of quantitative approaches to drive the evolution of medical therapies. The Imprint Hub was started about 3 years ago. It's a NICHD funded network to promote and catalyze research in maternal and pediatric therapeutics. The hub consists of 3 different groups. We at IU, Ohio State, Regan Street, Buffalo, and now Cincinnati Children's Hospital compose the Data Model Research Coordination Center. And then there's 2 centers of excellence in therapeutics, one at UC San Diego, focused on lactation and the impact of antibiotics on the metabolome of infants and mothers, as well as a second center of excellence at therapeutics at Vanderbilt University Medical Center, where they're utilizing their electronic health records and genetic information to focus on opioids and phenotyping. We also work in collaboration with a number of networks throughout the country and internationally, including the maternal fetal medicine units, the Pediatric Research Network, Impact, and others. We have a number of collaborations. Many of these have been formed through opportunity and support pool funding. You can see by the stars, including several of the speakers you'll see today have benefited from these awards. These awards provide for the opportunity pool $150,000 in total cost to faculty members and $25,000 total cost to trainees to help support research relating to maternal and pediatric therapeutics. There is an RFA open on the Imprint Hub website or the CTSI website if you're interested in applying. The letter of intent's due April 1st. The slide breaks down a little bit more what the data model research, knowledge research coordination center looks like. Again, it's a collaboration between Lang Lee and myself, with Lang leading the knowledge base core at Ohio State. Let me try to hide this so it's pulling up. The knowledge base core is collecting data from literature and other resources to develop a portal that can support maternal pediatric therapeutics. And Lang will be talking about this later in the symposium. Rob Bees and I co-lead the pharmacometrics and clinical trial design core with support of other faculty from here at IU, Purdue, and Buffalo. And then Sean Granis and Christopher Bartlett, along with Anita Mendoko at Cincinnati Children's Hospital, lead the real world evidence core, which is utilizing the electronic health records resources from Regan Street and the EPIC resources from Ohio State and Nationwide Children's, as well as Cincinnati Children's, to establish pediatric and maternal data mart. One of their goals right now is to link the maternal and pediatric records so that we can identify outcomes longer term from pregnancies in those children. There's also an outreach and dissemination core, which you will see featured on the website and social media, as well as a lot of YouTube videos. We have a webinar series once a month and support other symposia and topics and talks in maternal and pediatric therapeutics. And then the logistics core that obviously provides logistics and oversight, as well as supports the opportunity pool funding. The one of most relevance to this group is the pharmacometrics and clinical trial design core. As the name implies, we focus on supporting PK/PD modeling, but also in improving clinical trial designs. So Young Zhang is a biostatistician here at Indiana University with expertise in adaptive trial design, as well as bringing in Tom Callahan's expertise in drug development and clinical study design to support that. And then obviously you see the other faculty there, in addition to myself and Rob, Wojciech Krzansky, Deval Shaw, and Brian Overholzer support this core. One of the major, these are the goals of the pharmacometrics core, and one of the major things I like about this is it's not just those that you saw on the previous page contributing. We've reached out to bring in other expert clinical pharmacologists and pharmacometricians into discussions. The group at UCSD with Jeremiah Momper, Brookie Best, and Edmund Caparelli often contribute to this, as well as those many in this room who we will reach out to if it's a topic of interest to them or we would need additional expertise. So the goals overall are to bring together those expertise, develop integrative PB, PK, PD models, and to support model-informed drug development and clinical trial design. One of our primary goals is also to provide education, and that's where things like this conference come in to support young investigators in improving their pharmacometrics experience. That's kind of the introductory talk. I wanted to give just some brief logistics. As this is a virtual conference, it's really important that we utilize the microphones for question and answers. So when it comes time for Q&A at the end of the discussions, we really encourage interactive discussions at this meeting. But please use the wait until you get the microphone in your hand to start asking your question or providing feedback. For those of you who need a parking pass, please make sure you see Amelia for a validation ticket to be able to get out of the garage tonight. Wi-Fi is available for those of you from academic institutions. You can use the EduRoam. Others can use the IU guest Wi-Fi. And then we have beverage service right now in the back. I believe the coffee might be ready. We apologize. There was a mix-up and they brought tea and lemonade for breakfast. So, but there will be beverage service and water back there all day. Restrooms, there's 2 in the back this way. And then out here and at the other end is the women's room. So if you walk down the hall. We will have lunch in the hallway or in the alcove out here will be provided, and then you can bring it back in here to eat. So this is the map, and I know it's a little bit confusing. We will help you out as you get through the day. So this is the room we're in currently. Lunch will be, it looks like maybe in the back. Actually, I may have been wrong. It'll either be in the back or on the table out here, depending on how they set it up. Restrooms here and here. And then the parking garage, the elevators, if you've parked in the garage, you found those. The important thing here is dinner and poster session tonight will be in the ballroom in Tower Hall, which is connected to Hine Hall through this. And you will see arrows pointing to it, and we'll make sure you get there. Most of us know where, I think many of us know where that is, so we'll make sure you get there. So we're looking forward to that. For those of you who are virtual, we will be monitoring the Q&A session to, if you have questions, please feel free to use the Q&A button. Those here, please raise your hand and we'll get a microphone to you. And again, we hope that this can be a very interactive meeting. One of the main goals of this meeting is the networking for our trainees. So this may be a good time for me to ask about who's in our audience currently. If you're a trainee, can you raise your hand? So for those who are not trainees, these are the people you want to come talk to and try to recruit. For how many of you is this your first symposium? Right, welcome. If you have questions, look at all the others who are here. I think Rob and Mark and I probably have the most, and Rich and Mike probably symposia attendance. But so any of us can help you find things here, as well as Emily and Amelia outside, or they may be back and forth in here some too. So let's see, who is from pharmaceutical industry? All right, and that means everyone else is academia in here. So, uh, so great. It looks like we have a really nice mix of attendees. One of our goals is, like I said, is to have that networking experience. So tonight we'll have the poster session that will allow you to see some of what the trainees here are doing. There is a competition with that, so there will be judging. We have actually 2 awards. One will be for the best overall poster, and then the other will be for the best visual abstract. So we encouraged our trainees to submit a visual abstract style poster. So you'll see a few that look a little bit different than what you're typically seeing in poster sessions. And so we will have 1 award for the best visual abstract style and then 1 for best overall. So, and then tomorrow we will have a networking lunch where we will pair trainees with some mentors, and then after about 20 minutes, allow you to switch mentors so that you can discuss one-on-one with a number of senior investigators. So we provided on the handout, you see a QR code on the front. If you scan this QR code, it will take you to the website where you can learn more about the speakers, where we feature a full bio, and then we will just have brief bios as an introduction. So at this point, I'll take a minute to thank all of our speakers for taking the time and effort to be here. This symposium doesn't happen without your support. And finally, probably the biggest thanks for getting this symposium running this year is to our support team. Amelia Grant is my program manager. Emily Quinny is a scientific writer who does all these great visuals that you see, especially coming out on social. If you follow our social media for Imprint, you'll see a number of visual abstracts and information from her. And then Megan Creaser is our administrative coordinator who was responsible for getting everyone here and travel. So I could not do this without them. And I have to say, this is probably the smoothest that any of our symposia has run. It's the largest symposia in person that we've had, and I couldn't do it without their support. So please make sure they feel thanked too. And finally, another large thank you to our sponsors. I was really excited about the number of sponsors that stepped up this year to help support the symposium. We were able to provide the dinner tonight and the poster session because of your support. So we received sponsorship from Eli Lilly, Gilead, Metrum, ISOP, AbbVie, and then we also received a research grant through the IU Research and Creative Activity group as well. So we really appreciate your support, and not only the financial support these companies provide, but they also have been very supportive in helping us provide speakers for these symposia as well. That I thank everyone. Are there any questions for me at this point? Not, I will turn it over to Suha.